The biggest myth is that women don't need testosterone. Women actually make and have more testosterone in their bodies than they do estrogen. And just like estrogen, it goes down as we get older. Women have 0 FDA-approved options for replacing testosterone.
Well, why is that? Dr. Amy Killen is a leading regenerative medicine physician known for her work at the frontier of hormones, sexual vitality, and long-term health span. She helps people understand how hormonal balance, tissue repair, and proactive longevity strategies can radically change how we age and how we feel.
We have so many endocrine disrupting chemicals, toxins in the environment. The food we're eating and drinking, the lotions, the skincare, our Teflon pans, we can't get away from them. They are there. They're there to stay, but they do mess up a lot of the things in our bodies, including hormones and the way that they work in some people.
Are there any routes in the lifestyle bucket that can help reduce microplastics in the body?
The problem with microplastics are that we don't actually have.
Amy, thanks so much for being here.
Thank you.
What do you hope our listeners will get out of this episode today?
I talk a lot about women's health. I talk a lot about some different sort of quote unquote longevity, things that we can do to improve health. So I hope that we can shed some light on some options that are out there available for women. I also treat men, but I talk about women a lot.
You talk about a lot of things. I've been reading your Substack, from hormones in general, estrogen, GLP-1s, cold plunges, clitorises, which I definitely want to go into. So your work focuses a lot on women's hormones.
Yes.
Speak to me as a man who should really know more about women's hormones. Where should one start?
Well, first of all, thank you for asking the question as a man. Yeah, women's hormones are the chemical messages, right? They carry these messages around the body, and they're important for all aspects of health. And something that a lot of women and men don't know is that women's hormones change dramatically at around age 40 or 50 when they go into perimenopause and menopause. And this is different than what happens with men, where testosterone just kind of goes down slowly over time. Women's hormones, estrogen, progesterone specifically, fall off this kind of cliff at perimenopause and menopause that really affects not just how you're feeling, but also long-term health in many different ways.
Wow. Okay. That's okay. And when it comes to estrogen, so let's again speak, still talking to me as a man who doesn't know much. Is there something, one or two, three things that a woman can do when they're in their 30s and 40s to better prepare for perimenopause and menopause?
And the best thing to do is to start educating yourself. There are, certainly you can't stop menopause from happening. It is not going to stop. Currently, we have no ability to stop it from happening, because what's happening is that your ovaries, over time, you're running out of eggs. And so once you run out of eggs, the eggs are actually, the cells around the eggs are what make estrogen and progesterone for women. So you can't stop that from happening. However, you should know it's coming, and you should know what tools you have to fight the symptoms as well as the potential chronic problems that it can bring later on.
And so can you do things now in your 30s or 40s that affect the chronic conditions? And
absolutely. I mean, certainly, healthy lifestyle is foundation, I think, to any longevity or health protocol. So, your diet, how much you move each day, your connections, your stress management, your sleep, all of those things are always foundational. And anytime we talk about any sort of other intervention, we always want to start with a good foundation. And a healthy foundation will help prevent future diseases. And there's some evidence that you may be able to delay menopause a little bit just by staying healthy, by not smoking, things like that. So, we do have some tools.
Estrogen and testosterone are both pretty misunderstood. I think the lack of knowledge about both of them, especially with testosterone in women as well.
Yes.
What is the biggest misunderstanding about both?
Well, with estrogen, I think there's still the myth out there that estrogen therapy causes or increases your risk of breast cancer. This is not true.
Okay.
And I think also for testosterone, the biggest myth is that women don't need testosterone. And this is also untrue. Women actually make and have more testosterone in their bodies than they do estrogen. And just like estrogen, it goes down as we get older. But unfortunately, men have many ways to replace testosterone. We have many pharmacologic options. Women have 0 FDA-approved options for replacing testosterone.
Well, why is that?
It is because at least in the US, the FDA has just decided not to approve anything. The studies on testosterone they're not quite as good as the studies on estrogen. And people don't think it's as important as they probably should.
Very interesting. So let's say I'm someone who has nailed the lifestyle. I eat well, sleep well, great relationships, exercise, but my hormones are completely off. What is usually the cause of that?
It is very dependent on a lot of variables. But, it's certainly, if the lifestyle is completely perfect, which very few of us are perfect. So just to say that, I think we all try, but most of us are not perfect. But it could be any number of things. I mean, you could have polycystic ovarian syndrome where you're having some abnormal insulin responses or abnormal testosterone levels that can cause a lot of problems. It could be your thyroid, and it's nothing you're doing wrong, but your thyroid is not acting as it should. So when we talk about hormones, we're always casting a wide net. We're always checking a lot of different health metrics. Metabolic markers. We're looking at blood tests. We're also asking how you're feeling and having a conversation, and what's bothering you. Are you sleeping well? Those kinds of things. So it's not ever just one thing, but we kind of have to look at all the different hormones, metabolic tests, talk to you, and then we can try to narrow it down from there.
Are there any patterns though? I know it's always going to be an N of one, so everyone's going to be slightly different, but do you see patterns recurring?
Absolutely. I think that stress is a big problem. I think even those of us who think that we're controlling it pretty well are probably not. Our world is so stressful now. We're always on our phones. We're always trying to do things all the time. So stress and being able to get into that parasympathetic, so out of the fight or flight and into the kind of rest and relax and receive is very difficult for modern people in general. And that affects your hormones in many different ways. You're not able to make many of the hormones you need to when you're in a state of chronic stress.
It's amazing how much more attention is now put on health after COVID. COVID was a perfect container to really start understanding and forcing people to understand their health. I can talk personally about that. But in recent times, we've found new medical phenomena, and the big one recently has been GLP-1s.
Yes.
And I know you had a Substack, which was titled The People versus Microdosing GLP-1s. And you created this beautiful court scenario.
Yes.
With vigilantes and all that. You should be taking GLP-1s.
So GLP-1 agonists are the medications like Ozempic or Wegovy. They're, the generic names are semaglutide or tirzepatide. And these medications have actually been around for 15 or so years. Yeah. But they've gotten a lot of attention in the last 5 years or so because we're able now to use them for weight loss. As you know, they're originally approved for diabetes, but now we know that they work for weight loss, and they work by many different mechanisms. So right now they're only approved for those two things, diabetes and obesity. But what we found, and by we, I mean the community of doctors and scientists that are out there, is that these medications have a lot of benefits outside, or at least in conjunction with weight loss, such as they seem to be able to reduce the inflammation in your body. So, for instance, maybe you have arthritis in your knees, which is an inflammatory condition. They get kind of red, they get swollen, they're painful. That's chronic inflammation. There are many case reports and stories of people who take these GLP-1 medications in very small doses, and they have improvements in things like their arthritis in their knees. Not because of weight loss, but because of the inflammation. It's all still early days. We can't say it for sure because the studies are lacking, but there's a lot of potential benefits to these medications.
Do you think it's right? So I'll take me as an example. I have been... when someone asks me about GLP-1s, again, I'm not a physician, I'm not an academic, but I personally need to see more data, more information. I would say I have a tough time keeping weight off, but for me, it's too early. Like it's pretty much like the first or second innings.
Well, it's not actually that early. I mean, 15 plus years of data. We have a lot of data. And certainly any medication, any supplement is going to have potential side effects or downsides. So you should understand what those things are. But really, the media, I think, has painted GLP-1s as being more dangerous than they actually are for most people. You got to have a good doctor. You got to go through the screening process, make sure you're taking them properly, make sure that you're lifting weight, while you're taking them so you're not losing muscle mass. Like there are some key things you have to do. But I think that as far as we do have, more than a decade of data in population studies that's really pretty great.
Maybe I'm coming from like a European, more like fear-driven perspective. We have just launched the Beyond Tomorrow community, and I would love for you to be a part of it. Think masterminds with some of your favorite podcast guests, dinners and events in your city, accountability groups, free giveaways, and a space to have all your questions answered. And what's best, it's all for free. Just check out the link in the description below or head to school.com/beyond-tomorrow. That's skool.com/beyond-tomorrow. You are someone who you are pro estrogen therapy, and so why do you think there is that camp that are being more fear-driven when it comes to GLP-1s and estrogen therapy and LT and all that?
Well, I mean, let's be fair. Like we have been done wrong many times in the last 100 years or more by big pharma, if you will. From getting hooked on painkillers and the fentanyl crisis. There's lots of things that can come out of using medications improperly or being told that medications are safe when they're not. I think that there's a lot of fear out there for sure. And I think that there are a lot of people who want to do things as naturally as possible in their lives. They want to try to avoid medications. They want to just, stay healthy and exercise. And that's fantastic. Yeah. Natural is absolutely great. But it's not always enough because there's a lot of things going on in the environment in our world right now that I think makes it really hard. Even the healthiest of people sometimes need a little help.
You keep talking about the environment, the world. What are you referring to?
It's a tough place to be a human. This world. We have so many endocrine disrupting chemicals, toxins in the environment, things, whether it's the food we're eating and drinking, the lotions, the skincare, our Teflon pans, it's hard to get away from these things, and we can't get away from all of them. The microplastics, which are literally accumulating inside our blood vessels, inside the testes, inside the ovaries. We can't get away from them. They are there. They're there to stay, but they do mess up a lot of the things in our bodies, including hormones and the way that they work in some people. And so, we may need some help with some of those things. You may need some help with hormones and with weight loss, things like that.
You mentioned, the buildup of microplastics in testes and ovaries. I think Brian Johnson recently came out with this self-study, again, just himself, but doing, I think, sauna for 20 minutes a day for 30 days. Again, slightly misquoting that, so please do check the data. And he had some amazing results. Are there any routes that are a bit more, let's say, lifestyle, in the lifestyle bucket, they can help reduce microplastics in the body?
I think that yes. I mean, avoiding plastic as much as possible. Don't microwave. I have a son who's 15. He loves these plastic plates, and he likes to microwave them. I think he does it to make me upset. But don't microwave plastic. Try to avoid, storing foods in plastics, like things like that are common sense. Like, get rid of the plastics if you can. The problem with microplastics are that we don't actually have good tests available commercially, at least, to test your microplastic level. There are tests, but they haven't really been validated, and they're not widely accepted as being really good tests. So we don't even have a way to know really how much sauna is affecting your levels, or how much, plasma exchange or whatever. So I think that this is something that we'll see pretty soon. We'll see some good tests coming out. The other part of that is there's not a good way to test for the plastics that are already embedded in your organs.
Gotcha.
If it's in your testes, how are we going to check that? We can check your blood, but we're not doing a biopsy of your testes. So hopefully.
Super interesting. Okay. Adjacent to sauna, you've got cold plunge. You've got another Substack article, Got Cold, a doctor's 30-day deep freeze and slow dive into strategic cold therapies for women.
Yes.
Is cold plunging good for women?
Well, we don't really know for sure because most studies have been primarily with men. There's not really good evidence that they wouldn't be good for women. I think some women are scared because they think that they've been told that cold plunging is bad for them, even though we don't really have that data. There are always, certainly if you're overstressed and you have some like stress issues, adrenal problems, things like that, then cold plunging maybe isn't the best tool. But there are some good benefits that have been shown, especially recovery benefits from after exercise, helping your muscles recover sooner. And then in my own case, I did cold plunging for 30 days. I live in Utah and it was the winter. winter, and I had this cold plunge outside where it sat essentially in the snow, and I decided for 30 days I would get into it every day for 33 or 4 minutes. And I did it, and it was very hard. But what I found that I appreciated was it gave me this like mental toughness almost that I ended up later on really appreciating. It taught me how to kind of breathe and calm down, and I ended up having a kind of an emergency and driving in the snow one day where I found myself kind of switching into the same like slow methodical breathing that I had learned during cold plunging without even realizing it. I kind of switched into that, and I still think that it probably got me down that mountain in one piece.
Yeah, I have exactly the same benefits with cold plunge. Just the mental clarity, like reduction of fear. But again, anecdotal. I was sitting with Matt Caberlight recently, and he was saying how cold plunging and cryotherapy could reduce your body's ability to turn on its natural way of fighting inflammation, because we naturally, again, if we do a tough workout over a few days, we'll recover naturally.
Yeah.
Is there truth to that? Have you seen that?
I haven't seen that. I certainly have seen that you don't want to be cold plunging, after your weights workout, after your resistance training. And we know that. We know that if you cold plunge within the first few hours, you're going to reduce muscle growth by like 95% in 95% of people. So everyone, it's a bad idea. But I haven't seen anything about, problems with inflammation long term.
On to testosterone in women. Testosterone, the boss babe, understanding your body's power hormone. You're a phenomenal writer, I have to say. And again, it's TRT, and I know very little about testosterone for a man, let alone for a woman. I know that you want it to be high, but break it down for a man first of all. Why? How one can retain higher testosterone levels and what it means for a woman as well, and the importance for a woman.
Yeah, I mean, testosterone is important for both sexes. The things that it does, it works on your entire body. It is a hormone that affects your brain, your blood vessels, your muscles. But the things we think of that are associated with testosterone are your motivation, assertiveness, decision making, which is really important for people who are in businesses, for instance, muscle building, certainly, fat burning, libido, and for men, erections, really important for testosterone. There are a lot of cognitive benefits too. You need it to keep your brain turned on. Sorry.
I don't know why I feel like such a kid when someone says that.
You're giggling over here.
Yeah, exactly. Yeah.
It helps keep your brain kind of turned on and motivated and alert. And the same benefits are seen in women too. So pretty much the same thing happens in women than men. And what happens with both men and women is your testosterone peaks at about age 25. That's what you're making yourself. And then it just kind of slowly marches down each year that you go forward. But the good news is for men, at least, and it's been studied more in men, is you can counteract some of that decline with lifestyle.
Yeah.
Heavy lifting, getting a little sun, getting your vitamin D, keeping your stress down, making sure you're sleeping 7 or 8 hours a night, like some basic things like that, as well as just vitamins like vitamin D, selenium, zinc, can help your body to make testosterone. So it doesn't necessarily have to decline as rapidly if you're doing all of those things to stay healthy, which is great.
For those that don't know, Amy, you have Human Health, which is is it a clinic specifically?
Yes, yeah. It's a couple of clinics that franchise that we're working on expanding.
And how long has that been running for?
We just opened our first clinic a year ago in Austin, and then we have a second one in Florida, and then another one coming here in a few months, another one in Texas.
But you've been a physician for over a decade, right?
Forever. Yeah. I've been out 2 decades. Yeah.
What have been and I'm sure you were thinking about this when starting the clinic, what have been the biggest shifts and changes in the average person's health over the last few years? And what has made and how has that kind of shaped what you're offering people at those clinics?
That's a good question. I actually think the biggest shift is the reliance on our devices and the time we spend on our devices, and the lack of time we're spending with our friends and family and community and kind of getting out in the world. And it's one of the things that we don't talk about as much, in like longevity medicine is that lack of connection. But but we know how important, belonging to a community and having a sense of purpose and like just being social. We know how important that is to lunch. It's one of the most important things you can do to live a long life. And yet I think even my clinics, like that's not something necessarily that we're putting at the top of the list of things that we're helping you with. But it, I think, is one of the most important things. Like get off your phone and go to brunch and go for a hike with friends. Like that is something that I'm seeing over and over again in patients and myself. Like I got to do better.
It's tough. It's like the world, the tech has been designed exactly to keep us on it. It's something I really suffer with because I post on Instagram about it quite a bit, but I find myself late at night scrolling and waking up and scrolling and all that.
And we know it's bad for us. Like we all know it. And yet it's like an addiction. It's like oh, well, I probably should just check and see if anyone else has commented or liked. like, what if they have? What if they haven't?
Good old dopamine, right? What about something in the test results that you're seeing? As in increasing levels of microplastics or reduced levels of testosterone. We hear a lot about sperm quality and sperm count reducing as well. And
I mean, all of those things. I think that the kind of underlying problem that's causing most of those problems is just poor metabolic health. And that word basically just means that your body does not use energy properly. Energy in the form of food, essentially. Your body's not using it properly. So this is where, of course, we've got people overweight and obese. We have diabetes and then kind of insulin resistance, which is part of that. They say over 80% of Americans are metabolically unhealthy, and that's probably true in most of the societies out there. And that leads then to low testosterone, that leads to sperm problems, that leads to infertility. Like all of these pieces that we talk about, most of them stem from poor metabolic health.
There are so many myths around metabolic health. I remember when people used to talk about metabolism when you were younger. It's like, oh, that guy has a fast metabolism. That person has a really low metabolism. And people would assume it's what you ate and if you had these like crazy supplements that you've taken, maybe whether you're exercising. I really want to dive into the kind of hidden effects of metabolic health, like being on our phones late at night and not being part of a community.
Yeah.
What is the data showing?
Well, the phones, that's associated. Certainly phones, if you're on your phones late, you don't make melatonin and you're not sleeping well. We know that lack of sleep is a major driver of poor metabolic health, especially gaining weight, making poor food choices stems from lack of sleep. We know that the light is really important, and I'm not a light expert, but just like the amount of data on the importance of sunlight on your body for improving vitamin D, yes, but also improving serotonin to help you with happiness, improve we're energetic beings, like we're full of energy just going back and forth through our cells, and there's something about sunlight that is very powerful and very positive, and I think that's something else we're all afraid of the sun. Now, I think that the sun can be damaging, and I always wear sunblock on my face because I don't want to age too fast, but the sun is also very healing, and I think that a lot of us have gotten away from even being outside, like ever.
Yeah, I noticed that massively with my metabolism. Again, just me anecdotal, but over summer when I'm in the Mediterranean, I seem to not put on weight. And then winter comes and it's just like, damn, I'm just gaining weight.
Well, and we know, like there was a large study years ago that out of Sweden, which showed that people who got very minimal sunlight, the ones who were kind of at the lowest quarter of sunlight exposure, had the highest amount of cancer and heart disease and diabetes and multiple medical problems, and that in fact lack of sun exposure was similar to like smoking or obesity in terms of increasing your risk for a lot of these medical problems. So it's not it's one of these, there is a dose makes the poison part to the sun. You have to be careful. You don't want to get burned. It can cause skin cancer, but I do think that we need to talk more about the sun.
Perimenopause. Another article, how to peri like a boss. So creative. This is, again, the Substack title of Amy's. So let's educate the men first. Again, we have a lot of male listeners. I grew up with just women, so I feel like I had the privilege of having a single mum and two sisters, a twin sister as well, growing up, which taught me a lot about just women in general and how to date a woman and all that. But what does a man need to know about perimenopause?
Perimenopause is the 2 to 10 years before menopause. menopause usually starts at around age 50, but can be 45 to 55 or so and still be normal. So perimenopause can start as early as 35
Wow.
and still be considered normal. It can start earlier than that if you're abnormal. But perimenopause is this chaotic time where your ovaries are running out of eggs. It's kind of like your TV is like on the fritz, like it's like you all of a sudden you're getting like extra estrogen bursts for no reason. Your progesterone's declining, your periods are starting to be a little crazy, but maybe they're not quite yet. And what happens is in your brain, your brain is actually losing the ability to like make energy. And you see this dimming of brain energy production by 30% during perimenopause. No one tells you it's coming, but all of a sudden your brain works 30% less well. Your decision making, your attention, your mood, your ability to find words, like all of these things are associated with perimenopause as some of the things. There are many, many symptoms, but the lack of brain food in terms of metabolism is a big contributor. So lots of things can happen, but you can certainly get hot flashes and night sweats and weight gain and palpitations. And, there's a whole list of things. But the problem is women don't even know it's coming. And so they get all these symptoms and they go see a cardiologist because they're having palpitations. They go see a neurologist because they're having weird tingling. They talk to their psychiatrist about their depression, their suicidal thoughts. And they're getting prescriptions from each doctor for different things. But all of it's just because they are losing these hormones at perimenopause. And if we replace the hormones, you can oftentimes, not need all those prescriptions.
And what would they need to replace the hormones?
Usually progesterone is the first thing we give. That's the first hormone that goes down. So we'll give you back. We only use what we call bioidentical hormones, which means that the chemical structure of the hormone we give you matches the hormone that your body makes. So we're giving you back what your body was making, and we're just trying to kind of get you up to that optimal dose. So we'll give progesterone first, usually testosterone if you need it, and then estrogen as you get closer to menopause usually.
I'd just like to say a big thanks to our sponsors of this episode, Immortal Dragons, who are a purpose-driven longevity fund based out of Singapore. Immortal Dragons supports moonshot longevity initiatives and radical life extension technology. Get in touch with Immortal Dragons for pitch calls or their internship program via contact@id.life. And you mentioned a few things that a man or a woman can look out for. But let's say you've got a man who's in his 40s, married, and he suspects that his wife might be entering perimenopause. And what should he be looking out for? Because I can imagine partners sometimes have more awareness about what's going on than the individual. Sometimes. A big sometimes. Yeah.
The thing is, what's tricky about perimenopause is it can be 30 plus different symptoms. A lot of women say that they don't recognize themselves anymore, whether it's physically, like they look different, like they're gaining weight, their skin is changing, their hair is falling out, or whether it's more of a mental emotional piece. They're more depressed, they're more anxious, like high anxiety is very common. Not being able to sleep is very common. Waking up at 2 a.m., 3 a.m., worried about things that didn't used to worry you or bother you. Yeah. So a lot of women will just say, I don't know who this person is when I look in the mirror. Like I don't recognize her. I don't know where she came from. And it can happen slowly or it can happen pretty fast. But finding a doctor who understands what's going on, and there are questionnaires, there's all kinds of things that you can do to try to like dial in, is this what's going on? We could do lab tests, but finding a doctor who knows what's going on and getting help, whether it's in the form of lifestyle techniques, cognitive techniques, or hormones, or the combination, is really important because this is a dangerous time for women. Their depression is up, the suicidal rates are up. Like the women in perimenopause feel like they're falling apart. Not all of them, but many of them.
And would you say, what is the biggest driver of that change right now in terms of like increasing suicidal and depression rates?
It's just those hormones. It's the estrogen going crazy up and down, and then ultimately down, and then progesterone going down, and then to a lesser extent, testosterone going down. It's this big, like I said, it's this big kind of fall off a cliff of those hormones. I think about estrogen as being this invisible shield that women have that is there their entire lives. It's protecting your brain from cognitive decline, from dementia. It's protecting your blood vessels from plaque, so you don't get heart attacks and stroke. Women don't get heart attacks and stroke. They're about 10 years delayed from men because they have estrogen that's protecting their blood vessels. It's protecting your pelvic floor. It's protecting, I mean, your bones. But then all of a sudden in perimenopause, that shield starts to kind of dissolve. And by menopause, it's gone.
Yeah.
And so all of a sudden you have the advent of aging, rapid aging that hits all of the organ systems at one time. And so imagine how that feels. It can be just insanely awful for some women.
And a final Substack I'll mention is you had a Substack titled, "Hi, it's me, your clitoris."
Yeah.
Why did you write that?
Well, that was written from the perspective of your clitoris. And it is a hopefully educational piece about, what the clitoris is, how big it is, how it's much larger than you think. We only see 10% of it outside the body, how it's similar and how it's different from the male genitalia. And then it talks a lot about the changes in pelvic floor, vaginal, clitoral health as you kind of get older, the things you can do about it, what to expect. So it's kind of like I think it's kind of a fun piece, but it was meant to also educate women because I think we don't talk about these things and a lot of women have no idea.
Amy, I want to get into your crystal ball. The world is changing so fast. You've mentioned a bit about the dysfunction, dysregulation, disconnection. Where will we be by 2030?
I think that the technology piece, the AI, all the technologies coming together, that exponential growth curve is going to give us a lot. I'm excited about a lot of the therapies that are coming, a lot of the advancements that we're seeing. I'm excited about that. I'm terrified of the worsening disconnection, the less lack of purpose that many people will have as they kind of get replaced by AI. A lot of the things, the disconnection from nature. There's so many things that are great that are coming, but I don't think we talk enough about the things that we're going to be leaving behind.
What do you think is the antidote to that?
I think that as just regular humans, we just need to spend more time, putting our phones down and doing other things, going out. Like I'm a big nature person. I live in the mountains, so I love to go on hikes and I talk to the animals and it's a whole scene. But you don't have to do that. But I do think that prioritizing time away from our devices is something that if we don't do, we're really going to regret it as a society.
Women's health, where do you think that will be in a few years' time?
I'm excited about women's health. I think that we're finally at a place where women are talking about women's health for the first time. We're decades behind men's health in terms of research and in terms of discussing women's health. We're different than men, but I think we're at a time where women are actually finally talking about it and are excited, and we're kind of pushing to get more research done, to be included in research, to talk about menopause and perimenopause and clitorises. We're talking about these things. So I'm excited. We're going to continue to see some advancements in women's health.
A second ago, you said that there would be regrets if we don't get off our phones. Why will we be regretful?
I think that we're just going to continue to see a disconnection. Like we're going to continue to see lack of, being able to relate to people. We already see, at least in the US, we already see politics is such a big deal because we're getting fed completely different stories about what's happening in the world. My daughters are applying to college right now and they have to write all of these essays. And because they haven't really had to write much, they don't even really know how to write an essay. Their ability to communicate using their own thoughts and their own feelings and their own words is something that I think we're not teaching our kids as much. I think that there's just a lot of these kind of soft skills that seem silly that are actually really important for us as humans, and that I'm hoping that we don't forget that before it's too late.
Yeah, because with the podcast, longevity is just one of 4 components, 4 tenets. We have mindset in a broken world is so important. Mutual understanding. How do we break down echo chambers? And then how do we educate people on the breakthroughs that are coming? And I feel that we can't really talk about improving our VO2 max until we look at the things that are going to affect us in the next 5 years. And it's a bit worrying right now.
It is. I think, we have the choice. We have, as humans, we have the choice. We are at a bifurcation point. We are at a big point. Who knows what's going to happen with AI? There's a lot of, scary predictions out there. I can't control that, but I can control how much time I personally spend, on my computer or on my phone with my family, with my friends, things like that. So I'm trying to do the things I can do because there's a lot out there that I have no control over.
Absolutely. And then we're currently at the Global Longevity Summit in Geneva. And there's been a few interesting talks around therapeutics that have currently in clinical trials and that are being used in certain clinics. And there's been a bit of a pushback, especially amongst the academic community, who believe that there needs to be more rigorous data. As a clinician who runs a clinic, what is the balance between being, let's say, at the forefront of things but also balancing the risk as well?
Yeah, we always say we want to be cutting edge, but not bleeding edge. Like we don't want to be the people who are at the very first people to do any therapies, before we have any studies or any evidence that they're safe. But we do, if something seems really safe and we have some good evidence for a mechanism, then we're willing to adopt things. But it's difficult. I think we want all of the good studies. We want the randomized controlled double-blind studies, but those take 10 years, 15 years, depending on what we're studying, those can take a decade. And I think we're at a point where there's so many promising things coming, whether it's stem cell therapies or plasma exchange or, other things we talked about. These are available in some capacity, depending on where you live right now. We have some evidence that they could be really beneficial, but we don't have large studies yet. And so I think a lot of it's about what is your tolerance as a physician or a practitioner to the unknown, to not knowing, to risk, and then, how strong are the data points that suggest that it could be beneficial.
Talked a lot about the new technologies that are coming to the clinics. Has there been one or two in the past year or two that has just really excited you?
One of my favorite tools, which is available and it's approved and it's not hard to get, is called low intensity shockwave therapy. And this is a handheld device that just delivers high pressure sound waves through the skin. And it's in doctors' offices. It's fairly easy to find in the US now. But basically what this does is it sends these high pressure sound waves through the skin, into the body, and it tells the body that there's been some kind of injury. So it kind of tricks your body into thinking it's been injured. And so because of that, your body sends like some stem cells and helps to increase the blood flow and helps to reduce the inflammation. It's basically a way to improve healing and regeneration in tissue. So it's commonly used for like joint pain, fasciitis, rotator cuff injuries, like musculoskeletal stuff. But we also use it a lot for sexual health. So I use it a lot for like men who have some erectile dysfunction or they want to improve function. Lots of studies, actually really good studies on men for improving sexual health by getting to the root of the problem, by actually improving the blood flow, by improving the health of the cells in the area. So it's a fantastic technology. It is completely safe. It is well researched. We've had it for 30 years and it's still very underutilized.
And
another one, I really like the regenerative biologics, the stem cells, the things like that. But I think that they have excellent promise. We use them in our clinics, but they are, there's some regulatory issues. They are expensive. I think that we'll continue to see stem cells and other biologics that can help your body to repair itself. And hopefully we'll start to see ones that are not as expensive. The price will come down, will get, democratized, and we'll see, just more and more big studies and safety data on those.
As in you say, you do them in your clinic, but is it? I thought you can do it in the US. Stem cells.
So we live in, you can, depending on what types of stem cells. Like,
okay.
For instance, you could certainly do, you can get stem cells from the patient's own bone marrow or just from their blood. There are certain types that are available anywhere. And then depending on where you live in the world or even in the US, sometimes, certain other types are available and sometimes they're not.
What parting piece of advice would you give to a woman or a man to look out for over the next few years, especially when it comes to health?
I am really excited by this empowered patient idea. The fact that you, as a guy who you say you don't know a lot about medicine, I think you really do. But let's say you don't. But that fact that you have the access to so much information now about your own health, that you can keep your own health dashboard, you can upload your own labs into an AI and get a lot of information. That, certainly a doctor is still important, but the health part of what you're doing every day, you can do a lot of it on your own with the help of, all the data you're collecting on your wearables, your Aura Ring, whatever, plus how you're feeling. And you can really create your own health plan and then just use doctors to help, make sure that that's a safe plan and maybe give you prescriptions and things like that. But I just love the idea that we are finally, I think, empowering patients to take ownership of their own health.
Amy, thank you so much.
Thank you. This was fun.
If you want to know what tomorrow has in store like I do, you definitely want to listen to our recent episode where I talked to Peter Diamandis about a future where we could live forever. Thank you so much.